Thank you, Mr. Chairman. I'd like to thank the witnesses also for being here today. And I think as Republicans and Democrats, we all agree that we need a safety net and we need to strengthen resources for low income individuals to help them on a path to financial independence, as we've heard here today. As you can see behind me, we spend $1 trillion or more than 80 programs helping low income individuals. And these numbers are just from 5 years ago. So I don't know what the number is now, but I know 5 years ago it was a little over $1 trillion. I myself benefited from many such programs early in my life. My VOTEC training helped set me on the path that led me here today. But we need to make sure these programs are actually helping people. And somewhere in the last 20 years or so, we started teaching our kids that they must go to a 4-year college, and when it's not necessarily so. And college isn't for everyone, and it's not a prerequisite for success or financial stability. As a result of that mindset, jobs that required skilled workers, but not a 4-year degree, are facing shortages in the workforce. Countless Americans have utilized workforce development programs to learn a trade and find quality, high-paying jobs, just like I did when I was a teenager. When I look at these health profession opportunity grants, it sounds positive. Investing in workforce development, especially for low-income individuals. And healthcare is a high-paying field with endless opportunities. And for those willing to work, the HPOD program has randomized controlled trials to assess the program, which I'm very thankful for. But the data revealed in those trials is abysmal. Study shows that HPOD programs, program completion does not translate necessarily to higher earnings for recipients. Even more alarming, only 1% of HPOD recipients claim confidence in career knowledge. Only 1% were employed and only 7% experienced career progress. The grants did not decrease the necessity of public assistance for recipients. To me, these numbers indicate a failure. If this were the private sector, the program would have been killed already. And in the federal government, though, failing programs are rewarded with more money and less oversight and no reform. We need to ensure these programs like this result in employment and higher wages for participants. Otherwise, we're not helping anyone. Mr. Sullivan, I commend the work Leo is doing to test and support evidence-based poverty reduction programs. In your testimony, you mentioned Rosa, a mother of 3 struggling to navigate the complex mix of eligibility requirements for welfare programs. My biggest concern with our nation's safety net programs is that they often provide disincentives for program recipients to work and earn higher wages. They also sometimes fail to inform participants that they may lose access to government benefits if they reach a certain salary threshold. It's been talked about today. However, some participants already know of this cliff, and including low-income individuals, who fear that getting an increase in their salary will lead to a sudden elimination of their public assistance benefits. Going forward, we need to find a way to ensure that program participants are not forced into confronting these cliffs and are not deterred from seeking further workplace opportunities. And individuals should not be incentivized to stop their personal career development due to personal fears of losing those funds. So the question I have for you is, in your research, have you focused on the detrimental impacts that benefit cliffs can have by trapping participants in a cycle of dependence?
Thank you for bringing up the benefit cliffs, because it really is an important issue, and it's an important issue for those of us that are working on evaluating innovative programs at the local level. You can imagine being a case manager and exerting all this time, energy, and effort to find a better job for one of your clients, and then your client's earnings go up, but then realizes they lose. Could be food stamp benefits, could be a less generous housing subsidy, etc. That's a very challenging situation, right? So the nature of benefits tapering off can work against these efforts to try and increase employment. So it is a challenge for these local programs, and there are some things that can be done to smooth out those cliffs. The broad-based categorical eligibility in the food stamp program raised the overall income level, which allowed the eligibility for benefits to extend further up the income distribution, which took away a small cliff that was in the food stamp program. I think the biggest concern is when there are these sharp cliffs. Your income goes over a threshold and you lose access to, say, Medicaid or whatever it might be. And policymakers should be working jointly with local communities to figure out ways to not disincentivize these individuals from taking advantage of opportunities in the labor market.
Thank you, Mr. Sutherland. Mr. Chairman, I yield back.
Thank